I come across a lot of cases that are similar.
Dr. Barry Lavallee says he already knows what the investigation into the death of a patient who died after 8 hours in a Winnipeg hospital waiting room will say. He believes it won't examine what other factors might have been in play, like the man's race or socioeconomic status.
It's easy to let go of your responsibility when they're considered less in society. And I think that's what happened.
On Wednesday, the health minister ordered the death be treated a critical incident. Uzoma Asaguera says health leaders are investigating.
I want to reassure Manitobans this is being treated with the highest level of urgency, highest level of seriousness, and we're working very hard and very quickly to make sure that we can learn and take the appropriate action moving forward.
Officials say a middle-aged man died at Health Sciences Center while waiting for help that never came. He arrived by ambulance shortly after midnight Tuesday. He was assessed, taken to the waiting room, and shortly before 8 a.m., staff noticed his condition getting worse. Sometime after, he was pronounced dead. For Lavallee, this tragedy is all too familiar. He cherishes this drawing of Brian Sinclair, who died after languishing 34 hours in the same ER waiting room in 2008. Lavallee was part of the group that explored how racism impacted Sinclair's death. In this case, he doesn't want health officials to simply lay the blame on an overcrowded ER.
You can't blame people for being poor and blame them that the healthcare system is falling apart because we have a lot of poor people. That is absolutely unethical and absurd.
No identifying details about the man has been released, but Lavallee says this patient was clearly ignored.
The confluence of context for this one man was that he needed some help. If you couldn't hear him asking for help, then you're the problem.
Asaguera expects to get a preliminary report within the next couple of weeks. The PC health critic says that report should be made public.
The Premier has said in the past that it's important that Manitobans have the confidence that when they go to the ER, they're going to get the care that they need. Restoring that confidence will mean making the details of that investigation public and even more importantly, an action plan to deal with what went wrong.
Asaguera, though, has promised that the final report will be released. Ian Fraze, CBC News, Winnipeg.